At the current time, the role of immunotherapy in head and neck cancer is restricted to recurrent metastatic head and neck cancer. So we're talking about patients mostly who've been treated for cure, sometimes with multiple attempts at cure, who are no longer curable. And this is either as a consequence of metastatic disease, cancer that's spread outside of the local regional area, or cancer that has recurred enough times that you're out of surgical and radiation options. And you're talking about patients who've been previously treated, who are typically platinum refractory. That's where nivolumab and pembrolizumab have their FDA approval and where their standard use is found. However, we are actively investigating these agents, as well as others, in other contexts. There are multiple clinical trials that are near reporting looking at the role of single or double agent immunotherapy for the first treatment of recurrent or metastatic head and neck cancer, and there are multiple clinical trials integrating these agents into cure. These fall into two basic areas, perhaps three. They're being studied as induction chemotherapy, so either immunotherapy alone or immunotherapy given with chemotherapy before an attempted cure, such as surgery, radiation, or chemoradiotherapy. And second, they're being evaluated together, concurrent with radiation. And then there's at least one study looking at them in the adjuvant context. These studies are very important because your average head and neck cancer patient is not incurable. In contrast to many other cancers, your average head and neck cancer is locally or local regionally advanced and being treated for cure. And so there's real hope that these agents can improve the cure rates in those contexts.